Steve Edman, massage therapist and
CVCP certified, the certified veterinary chiropractor.
There you go. I'm glad you clarified that. I've got those initials and I still can't say it. So, massage therapist that suddenly comes across some literature and thinks, hey, this sounds interesting. Is that how it went down?
Actually, what happened was I owned a clinic in Forest Grove, and I had 2 chiropractors in my office with me, and they received literature about equine myofascial release, and I got excited about it because I do myofascial release on people. And so I called Dr. Inman and said, hey, I'd like to take your course. He said, you can't do it, you're not a doctor. We talked for a few minutes. He kind of vetted me out, asked me a bunch of questions that he figured I couldn't answer. And when I did, he said, oh, well, you can come to my course. And so I went to the courses in 2003. I went to the course in Portland, Oregon, and after the course was done, he actually invited me to go to his Orange County symposium that he did, and I worked with him down there with the vets and chiropractors down there, and we just kind of started working. I work with him on whenever he comes to Portland. I host his seminars. But I've been doing VOM since 2003, and it's been amazing.
So I notice a lot of people that have taken the course will continue to go on to more of Dr. Bill's courses.
Mm-hmm.
Why is that? I mean,
because it's information. He's a encyclopedia of information about the body and neuromuscular stuff. He's neurology. And he's a scientist basically that is willing to give up whatever he knows to people. And that's hard to find someone who has that knowledge base that's willing to share as much as he does. And so it's always an experience to take a seminar with Dr. Bill.
So you also doing the laser therapy?
I do cold laser therapy. Funny story about that is that he was bugging me to get a cold laser for a number of years, a couple of years. I think I did VOM in 2003, and I think it was about 2006, 2007 that he finally said, you just have to get a cold laser. I said, okay, I'm thinking about it. And I had 2 horses that got injured, had some pretty serious nerve damage and muscle damage, trauma, and they would have normally been put down. And so I rented a cold laser from a local chiropractor to treat my horses, and I was able to turn them around in less than a month and get them sound again using cold laser and VOM. And so I, from that point, said, okay, sold, I'll get a cold laser. And
so now, do you use the 2 modalities together in most cases?
Absolutely. I don't use one without the other ever. Plus, I still do manual work on the horse. So I find that the VOM does a certain part, the cold laser does a certain part, and then, if necessary, I do manual therapies also to enhance the cold laser and the VOM.
Now, a lot of people who have horses hear that awful word navicular disease or founder and think that's the end. Is that something that you use the laser for?
Absolutely. First of all, let me clarify, I don't practice veterinary. Mm-hmm. I don't diagnose, I don't prescribe, but I follow up behind vets around the area, and oftentimes my regular clients will call me when they know they have a certain problem, and I've had a tremendous amount of success with navicular and laminitis with the cold laser and VOM therapies. It's literally turned these horses around that normally would have progressed on into a much worse condition or not be used anymore. A couple of roping horses I can think of in particular that were brought back to normal function or are back in competition after they were diagnosed with navicular. So it's been an amazing technology.
So you are here now at another seminar. What's the big thing you picked up after? Well, it's day 1 we're talking, and what have you picked up today?
The biggest thing I pick up when I come to, anytime I attend a seminar or even help out with a seminar, there's always a little something that I learned when I first started doing it, but it gets reinforced or explained in a better way for me. And today it was an excellent review of what the different cold lasers are that are out there, what the difference is between each cold laser, and why is the specific cold laser that Dr. Bill, specifically your Zirconia laser, why that's used over all the other models. And he went into some pretty good detail about the physiology of that, the biological basis for cold laser, in a way that I can explain to other doctors or chiropractors or anybody that's on a professional or scientific level that will understand. They'll get it with the information that I can present. And so that's probably one of the biggest things that I got from it today.
So when you look back, do you sometimes wonder how you did without these?
Oh, absolutely. Absolutely. I would have lost a couple of different horses. I can think of 3 different horses, personal horses I would have lost. And I have friends who would have lost horses in the last 7 or 8, 10 years without the VOM technology and the cold laser. It's been an amazing resource.
And I think that pretty much says it all. So we want to say thank you very much.
And I also work with dogs too. So.
Okay, so you see in all sides, and we wanted to make sure people know that equine horse, huge industry, huge amount of problems.
But as far as dogs go, I had a German Shepherd that was having seizures, grand mal seizures after she got kicked in the head by a horse, and I was able to control those seizures for over 3 years until she sustained another injury that we eventually had to have her put down. But I was able to control those grand mal seizures for 3 years and get them in control and keep her on the lowest doses of medication possible to keep her stable. And that wouldn't have been possible without the cold laser. So.
Wonderful. Well, we thank you so much for your testimonial today.
You're welcome. Thank
and
you.
I know that you'll be probably going to some more seminars of Dr. Bill's.
Absolutely.
Always something to learn, right?
Absolutely. Nobody can stop learning.
Thank you so much.